Hi, Tom. Thank you for joining me today, and thank you for your time and sharing some of your unique stories with our students today. You have quite a unique health history and quite the experience with the healthcare system. So please share with us, what makes you so special?
Thank you. Yeah, I'm Tom, and I am a zebra. I was diagnosed with the Alpha-1 antitrypsin deficiency in 2005, and for 5 years prior to that, I was trying to find out what was going on. I had quit smoking 10 years prior to that, and right away I went into exercising and stuff to build up my health and or restore my health. But over the next 5 years since I quit, I deteriorated and was short of breath and couldn't walk up a flight of stairs. I didn't understand what was going on, and I'd go to see my primary health care physician, and he or she would say, "Oh, you're just getting old," or whatever. And they'd look at the health record and see that I was a smoker and just stop right there. Well, I kept at it, and something ain't right. It's getting worse and worse. And finally, I went changed a couple, two, three different doctors, and then got the right diagnosis, but only by pushing for it. She put a pulse oximeter on my finger, not the nurse, but the doctor did, and it read 91 for oxygen level. And she let out a oh dear. And that I knew that wasn't good. I had no idea what she was putting on my finger, but I realized that that was not a good thing. So she sent me to a pulmonologist, and the pulmonologist told me that we were going to do a lung function test, and we did that. And it turned out that the report was I had severe lung damage, and already in 2005, at the age of 49, I was at a 43% FEV1. Currently, I'm at a 35%. So 35 of what a normal person would be at my age, I only have 35% lung function of what that person would be. But I was lucky because that pulmonologist did a blood test, said he was checking for something, and I had no idea what he was doing, and he got the results a few weeks later. I came in, he said it was this Alpha-1 antitrypsin deficiency. What is that? Well, he told me it's a genetic disorder, and one of the it's the reason your lungs are so damaged. You don't have the protection of that protein that protects normal people with their lungs. You don't have it. It's all that protein is stuck in your liver. And he put me right away on augmentation therapy. And then later I found out from another pulmonologist that I went to at the University of Chicago. He said, yeah, if you weren't diagnosed when you were, you'd be dead by now. And it was 2010 that he said. So, and that's basically what the pulmonologist said that day I was diagnosed. You're either going to have a double lung transplant or die in the next 5 years. Well, this is 2020 and I'm still here, and that's because of the augmentation therapy. Now, the other reason I'm a zebra is I have an inclusion body myositis now that's developed not developed in 2016, but I was diagnosed. And to get a diagnosis of that disorder, which is a autoimmune disorder that affects the muscles in my hands, my arms, my legs, and it weakens and atrophy and all that stuff, the muscles. And in order to diagnose it, they had to take a Tootsie Roll sample of muscle from my thigh, and they sent that off to Mayo and was able to diagnose that I have inclusion body myositis. So only 20,000 people in the United States, it's estimated, has that disorder. So that makes me a full-blown zebra right there.
Yeah.
But Alpha-1, I'm not a zebra. And I say that because it's estimated there's close to 100,000 people in the United States that have the disorder, but only 1 in 10 are properly diagnosed.
Yeah, it's quite difficult to diagnose. That's right. Yes. And it's so important to diagnose it early. Yes,
Yes.
very true. Tell me, you'd said basically, it took 5 years where you were struggling and trying to figure out what was going on. You switched healthcare providers back and forth and, were trying to find an answer.
Mm-hmm.
How did you feel back then? How did you, what struggles did you have with the healthcare system, with your providers in terms of trust and such things?
Yeah, so frustrated, that they wouldn't go the extra step or poo-pooed me right away. It was like they weren't listening, to what I was saying and offering. Or how you can tell if somebody's listening, they look you in the eye and they're repeating back stuff and all that. I didn't get that. So I was extremely frustrated and worried, so.
You also said that, you were a smoker and you think that, that's what they kind of focused on. So, they had a preset mindset. Basically, they thought that it's due to, the damage that you did to yourself due to your smoking, and didn't look deeper into the problem, actually.
Yeah.
Yes. Until you found that right physician. How did you feel about when you finally, had a physician who found out what's wrong with you?
Yeah, and she was one that was so caring, and you walk in and you feel like they really care about your situation, and you felt listened to, and I could communicate. And I mean, it wasn't her first guess, so she'd already sent me off to get a heart stress test, and I aced that. That was no problem. But yeah, and then came back and was then able to talk to me about what the results were, and followed up and helped me later on through the whole process as well. So that was so nice to find the right one. But feeling frustrated also motivated me to get more involved in the patient community. The lack of awareness of Alpha-1 is with only 10% of the population that know that. I wanted to create the awareness, so I got involved as a support group leader to help patients in our community here in Fort Wayne. I also got on the board of directors for the Alpha-1 Association and the foundation, Alpha-1 Foundation, and then also helped as the patient representative on the medical advisory and scientific committee for the Alpha-1 Foundation to represent the patient's interests as well in that medical advisory board. And then also talked to congressmen and been to Washington, D.C. a number of times to talk to representatives there, and gave 2 congressional briefings on my story with Alpha-1 as well. And that's
help our young students understand why it is so important to get involved in your own health, to be an advocate for your own health, basically.
Yeah. And and then after I got involved as a support group leader, I would learn of other patients that had finally got the diagnosis, but the reason they got the diagnosis is that a loved one or a relative of theirs, their mom, a cousin, a brother, or sister, they died. They actually did die of the Alpha-1.
Right.
And then it was only after that diagnosis that they were aware of that Alpha-1 is a genetic disorder. Yeah. And that other family members can develop it as well. And so they got tested and found out, yeah, that I was that person that I was talking about was also had the Alpha-1 as well. In fact, the founder of Alpha-1 Foundation, that's how he and his twin brother found out, is their mother died at age 53 of the disorder. And at that time, there was no Alpha-1 Foundation, but it motivated him to do that. So
right, yeah. Tell me, did you ever have Did you ever experience a medical error or a situation, where you said, well, they could have handled that differently, they could have found that out long time ago. They could have done better tests or something like that.
Yeah. Oh, yeah. I figured, that story of the error of omission, the error of not testing. The test for Alpha-1 is it's free. There's no reason why that couldn't be done. The Alpha-1 Foundation at the time offered free testing and still do for that. And we talk about, we tell pulmonologists and primary care doctors, why not rule it out? One out of every 33 patients that a pulmonologist sees in a day is an Alpha-1 patient, 1 out of 33. And why not rule it out? But another mistake that's happened twice, not related to the Alpha-1, but maybe it is, but another mistake that was made was I woke up twice during a procedure. One procedure was a hernia repair, and then another procedure was a colonoscopy, and where I was fully awake, and the colonoscopy, I wrestled with, because he was all in. If you know what I mean. He was all in, and I got reached, well, I won't go into detail, but it was not fun. It was awful. And so I talked, and what do I do as a result of that? I make it clear that before I have a colonoscopy or any procedure, I've had bronchoscopies, I've had colonoscopies since then, that I tell, hey, I've got, this has happened before, and I do not want it to happen again. I tell it to the anesthesiologist.
Right.
That I don't want this to happen again. And it has not. Thank goodness.
Glad to hear that, yes. So tell me, with all of your procedures and everything that you had done, and so many decisions that needed to be made regarding your health, to treat your different conditions, have you ever been given the opportunity to share in decisions made about your care? Have you been included, in the decisions regarding your treatment or surgeries?
Oh, yeah. I mean, I make it a point now. I'm more persistent, and I make sure that I'm involved in the care, and I think that's important. But the other thing I wanted to say about it is I also want to make sure that I understand what the healthcare provider is telling me. And I think it's important for students that they concentrate on making sure that they are using patient-friendly language when communicating with their patients. Making sure that they truly understand, and not pretending that they know these acronyms or abbreviations or medical terminology. You could, and then I'll ask what do you mean by that? What's this going to mean? What are the risks? What are my options? What are my choices, and why? So I think it's important for the patient to do that, but I also think it's important for the healthcare provider to explain it in patient-friendly language.
That is very good advice. Yeah, and that is very true. Adapt how you talk to your patients, depending, on the knowledge of your patients. You are very involved in your own health. You know very much about your own diseases, and the reasons, the sources, and what kind of treatments are out there, because you are so deep involved in your own care. But there's other patients who do not necessarily have all that knowledge, or who might be at the beginning of their journey, and just figuring things out. So listening and talking with a patient-friendly language, yeah, that's very important. That is very good.
One of the things that is unique, I thought was unique at the time, maybe not so much now, but in the Alpha-1 world, we have the foundation has identified a number of expert physicians across the United States that are pulmonologists, obviously, or liver doctors. Alpha-1 also affects patients with the liver. I don't have any liver issues, but they've identified these pulmonologists as Alpha-1 experts, and they encourage any Alpha-1 patient to have a pulmonologist in their hometown. So I have a pulmonologist here, but occasionally I go to Chicago then to visit Dr. Hogarth, who is at the University of Chicago, and he's an expert in Alpha-1. So he kind of goes over, not kind of, he does go over my records and does his own tests and make sure that the pulmonologist here in Fort Wayne is doing what he should be doing and is up to date on the latest information. And that whole concept was new to me, after, and that has worked really well. And I wanted to tell one story too about another Alpha-1 patient, a good friend from up near South Bend. He was identified as an Alpha-1 patient, and he got on the augmentation therapy, which is prescribed and recommended to do weekly. And his doctor said, well, we'll just do it once a month. And I said, well, I'm no physician, I'm not a healthcare provider, but I think you need to be a little more proactive and tell them that that's not quite right. And he ended up going to Dr. Hogarth as well, the expert. And Dr. Hogarth did have a little visit then with the local pulmonologist on what he should be doing and what he should not be doing.
Very interesting.
So that's one of the stories I wanted to share. And then the other thing about that same fella, he was one of those that was diagnosed because his cousin did pass away, and then they were smart enough and to get everyone tested in the family.
Yeah, that's probably very important then. Yes, to test anybody in the family. Yeah, that is good as my advice as well. Yeah, very good. So physician education is very important, and that physicians educate themselves as well as others, share the information with their colleagues so that they are up to date on the newest treatments out there and the frequency of treatments, I would say. So that's very important for our students to know as well. Do you have any other advice that you can share with our students, in your many encounters? How do you like your physician to treat you, or the healthcare system, all the nurses and everyone who's involved, always be open and honest and...
Oh, yeah. Yeah, I wrote down a couple of things that are really important to me. I think one of the best things a doctor or healthcare provider can do to, establish a connection with their patient, you smile, create that welcoming environment. Express understanding and show that empathy that I do really care about your healthcare. And then use the patient-friendly language, but truly listen. And the other thing I've really grown to appreciate is those physicians and healthcare providers that have easy access to information, easy access to that healthcare provider, whether it's, I know that there's the HIPAA rules and use of email, but at least have a portal, a healthcare portal that provides, test results, easy refills, and put access to the nurse and the doctors and stuff on simple questions that you don't need to schedule a visit for. Just have an easy way to communicate to make sure you got that kind of system in your new office. And for scheduling appointments, good heaven, I mean, I've got 10 different healthcare providers or people involved in my life, and it's a full-time job managing it from the patient perspective as well.
Yes, absolutely.
And then learn to listen and listen to learn. I think that I've heard that. I don't know whoever came up with that, but have that in there. Help You know, it was such a blessing to get connected to the patient community for me, you know, other people with the disorders. You know, with any chronic illness, there's a component to not only the symptoms that they have, but also the mental situation and stress that they go through having a chronic disorder, whether it's Alpha-1 or infusion body myositis.
And the support that you get from others, yes.
Whatever, you know, that they have a support system in some way with their family, but you know, connect them to that patient organization to find opportunities, or you know, they've got enough to learn, these kids, but you know,
this is very important too, you know, finding resources out in the community, no matter what it is. You know, it can be simple things like patient support groups that are out there, you know, organized through healthcare providers, or standing on their own. Any kind of resources, that's very important, you know, to make that connection. Yes, absolutely.
And you know, too, you know, in this day and age, once you get a chronic illness, oh my gosh, you're also up against financial issues. You know, do you have insurance? Even if you do have insurance, family savings can be decimated. You know, you could lose your job because of this, fired because you have this. And then the family dynamics with Alpha-1 being a genetic disorder, there's some sense of guilt of passing on a bad gene, you know. My mom feels a little, you know, and I try to say, you know, it's not your fault, it's whatever. And you know, I passed on bad genes to my kids. They are carriers. I have 4 biological kids, and they're all carriers of this disorder. And they have to, because of that, they have to be careful of their lifestyle as well. It's twice as dangerous to be a smoker. Well, it's never good to be a smoker, but even more so if you're a carrier.
Yeah. Well, thank you so much, Tom, for sharing all your unique experiences and stories with us. That was very helpful for our students.
Thank you.
We very much appreciate your time. And well, I guess I will see you again soon.
I hope so. Take care.
Thank you.